Seeing on the second house, we just,
Good morning, all. It's a big day. We've got some good decisions to make. Looking forward to the conversation. Dana, welcome. Sorry, good, jump right in.
All right.
You've got first two agenda.
Yes, I did. Okay, so the first thing I wanted to bring up, there was a question at the last meeting we had on the 11th about voting. So I just wanted to make sure, since that was a consensus meeting, we discussed that at that time, but now that there will be votes, I wanted to make sure everyone was clear on how that would proceed. Also with having the 6 members currently on the board, that was an important question as well. So based upon Robert's rules, which Trustee Westcott did bring us last meeting, there is the general idea for larger boards that the chair would not vote. However, Robert's rules does say that if you have a smaller board, 12 or less, that the chair can vote. So that's where we started. Then I went into our bylaws to see if there was anything different that had been decided upon over time. And there wasn't. It was actually the reverse. So the way the bylaws read say that every trustee has to vote unless there is some reason to recuse themselves. So based upon that analysis and the historical voting that's gone on thus far, the overall reading is Robert's rule says under 12 on the board, the chair can vote, and the bylaws also reaffirm that.
Thank you, Paul Scott. Thank you. Just for clarity, I had only brought that topic up because we had a tie. I was
Yes.
looking for an easy way for us to get out of a tie vote. So I would agree with your assessment completely, and quite frankly, since there are only 7 of us and we are elected, it would be a shame for one of those individuals who was duly elected to be silent as well. So but it was solely for the fleeting thoughts that let's break the tie if we can to make it easy. So thank you.
Absolutely, and that may happen moving forward. So it is a good point to bring up and discuss. Since we do have 6, there could be many more ties until we have that 7. And in the event that there is a tie, the motion fails. So it doesn't formally pass, obviously, because there's not a majority, and then another motion can be made on the table. So we know what to do in that situation as well. All right.
Thank you. Appreciate that.
Okay, so now we can move on to an overview on the VCOM sale. So everything with VCOM has been moving forward great. We are set to close on Friday. So we are very close to the finish line. Part of what we are doing in preparation for finalizing the documents. So there hasn't been obviously the closing documents signed, anything like that yet, because we do need an order of operation to have 2 resolutions passed by the board. We were going to do them at tomorrow's meeting, but just because closing's on Friday, we wanted to make sure we had enough time to get everything signed, notarized, etc.
And the buyer's party is harder to pin down sometimes.
Yes.
That was quite a bit of work.
Yeah, so we have sent everything that needs to be signed by VCOM has been sent to them as of yesterday. So just Dr. took Rollins, she travels a decent amount. We wanted to make sure that she has time to sign everything and get it back to us by Friday. The deposits have all been made, that's being held in escrow. So then the final wire will be on Friday when all the documents are exchanged. And then the sale would be final as of Friday. So the first resolution that I have here is 2026-02, which is the resolution that deems that the property is surplus property. So we'll go through this first resolution here. And it states that the district as the owner of the real property located at 1110.
It's in our Thursday packet.
Oh, I apologize. Yeah.
It's attached
It's in
there.
I apologize too. The change happened after the documents were sent out.
Yes, and that's why I wasn't sure. I saw you sent out the updated
Well, you're
agenda.
gonna
That was
read
good. I'll read it too, but you can read along. Okay, so let me know we're good. On 2026-02 is the first of the resolutions. So this states that the Indian River County Hospital District obviously is a special taxing district created by the legislature. And the district's board of trustees is a body public and corporate and the governing body of the district. The board causes true and accurate minutes to be kept of all business transacted by them, which minutes, records, and books of account shall at all reasonable times be open and subject to the inspection of the residents of the hospital district, subject to restrictions provided by law. Now we get into the specifics here. Whereas the district of the owner of real property located at 1110 35th Lane, situated in Vero Beach, Indian River County, with the legal description of, and there's the legal description there of the property that we've all referred to as the HSB or the Human Services Building, Health Services Building. I've seen it as both over history. Whereas Edward Via College of Osteopathic Medicine, also known as VCOM, provided the district with an offer to purchase the property. Formally on June 5th was the signature, 2026. Whereas in order for the district to sell the property to VCOM, the trustees must determine by resolution that the property is no longer useful in connection with such health facilities and health and medical services provided by the district. So that means that it's not needed anymore for the district's provision of services. And therefore it is deemed surplus property. Therefore, it be resolved that number one, the trustees determine that the real property located at 1110 35th Lane, situated in Vero Beach, Indian River County, is no longer useful to the district in connection with such health facilities and health and medical services provided therein, and is deemed to be surplus property. Number two, the trustees hereby memorialize the acceptance of the offer to purchase from VCOM and agree to move forward with the process of selling the property to VCOM for fair market value as determined by an agreed upon appraisal, which was completed, subject to the commercial real estate purchase agreement between the parties. That agreement also has the same legal description as mentioned earlier in the agreement. And if approved, this resolution shall take effect immediately upon its adoption. Dated, and this will have to update it as tomorrow. I'll update that to today for the effective date. Any questions on the first resolution?
Any questions?
Thank you.
We need action on this today, correct? So we need a motion to approve.
So moved.
A second,
Second.
thank you.
All right.
Any discussion?
And I'll go real quick.
I just approved.
Okay, I need to ask for,
This is an emergency phone call.
I need
Sorry.
to ask for public comment.
Mhm.
Any public comment? Seeing none. We have motion, we have second, all in favor?
Aye.
And Karen said, oh, she left.
Alan, you're muted.
You're right, but I said aye, you just didn't hear.
Promise, promise.
Okay.
Okay, motion passes, thank you.
Okay. So the second resolution in order of operations, we've now deemed the property to be surplus property. Now this second resolution is to approve the actual sale. So there cannot be any signatures on the final closing document until we have this particular resolution approved. So going through this all in the order of operation, and then upon approval, we will have Carrie sign the closing document subsequent to this meeting. All right, so resolution 2026-03 for the sale of 1110 35th Lane, Vero Beach, Florida, 32960 to VCOM. Again, we have the whereas clauses in the beginning stating that the Indian River County Hospital District is a special taxing district. That the trustees are the board of the governing board of the body of the district. And with the accurate minutes in accordance with the Sunshine Law, any of the minutes that are recorded here based upon the information discussed can be accessed by anyone within the hospital district jurisdiction. Whereas the district is the owner again of the property located at 110 35th Lane with a legal description of, and the legal description is set forth there. Whereas Edward Via College of Osteopathic Medicine provided the district with an offer to purchase the property on June 5th. And in order for the district to sell the property to VCOM, the trustees determined just now via resolution 2026-02 that the property is no longer useful in connection with such health facilities and health and medical services provided by the district, and it is surplus property. Whereas the district accepted the June 5th, 2026 offer from VCOM and agreed to move forward with the process of selling property to VCOM for fair market value as determined and agreed upon by the appraisal, subject to the commercial real estate purchase agreement with the legal description set forth there. Now, it is therefore resolved that the district hereby authorizes Carrie Bartlett, its board chair, to finalize execution of a commercial real estate purchase agreement for sale and purchase by and between the parties with a fair market value purchase price of $4,650,000, and the parties shall work towards closing on the subject property. This resolution shall take effect immediately upon its adoption. With this, it would be the 19th of August, 2026, which we will update. Any questions on resolution 2026-03?
None, okay, may I have a motion?
So moved.
Second.
Does any other comment, public comment? Any public comment? Hearing none, we'll take a vote, all in favor?
Aye.
Aye.
Thank you, motion passes.
Yay.
Wow,
Yes.
wow.
Thank you, that was a long time coming,
Been a long time.
but it ended, it's concluded the way it should.
How long has the district had that property? Does anybody know?
Since the seventies.
Seventies.
Part of the big parcel.
Yeah.
Yes. It was a very interesting.
Well done, Dana.
Thank you very much.
And so for both of those resolutions, Carrie will have them updated. You will sign and then Karen, you as secretary will also sign. Okay.
Very good, all right. Right.
So let's talk about the budget a bit. And we have several things to talk about today, of which Jenny will walk through, but I think it's important, as we did the past two prior meetings, to just start with a level set. And you have in your packets what our tentative budget looks like at both 7450, our tentative millage, and 7121. Our rollback rate. So I just want to bring your attention first to the reserves in both cases. So we walked through, so this is really the bottom line of that budget. So if you look at your budget sheet, you go all the way to the bottom. We can add the 4.65 million now.
What are
which-
we looking at? Hold on.
It's back.
Correct.
This one, okay, in the budget sheet. I just,
Oh, no, excuse me. No,
Sorry.
you're not looking at that one. I'm sorry.
not this one?
No, let me just walk through it
Oh.
totally. Yeah, let me walk through it. You should have the budget walkthrough in your chairman's packet.
Right.
Okay,
We're setting.
It's this,
correct,
it's this we're talking about.
correct.
Okay.
The
Correct.
chairman.
So that sheet has the two scenarios. We've got a lot of paper going around.
Exactly.
It's page
Wrong packet, Paul,
105.
Yep. With the paper clip, there it is.
Chairman, or any.
Yeah.
I was-
It's this-
Right. So let me wait for everyone to get that in front of them.
Thank you.
Okay, so let's all take a deep breath. And I'm being serious.
And make sure everybody's got.
And make sure that we're all on the same page,
Yeah,
literally. And we're gonna take this slow, we're not in any rush.
we had 3 hours.
That's right. We can use every last minute. Are we all set?
Mhm.
Okay, thank you.
So I'll draw your attention to line 267. Okay, does everyone have a line 267? So depending on which budget you look at, the line is the same, but I just want to explain. Now that we have finally booked, even though we haven't had the closing, the 4.65 million for the sale of the HSB, under our tentative millage, 0.7450, that will put our reserves, all cash, all investments at 10.9 for September of 2027, where that number, which is well within our reserves policy, and at 7121, which is the same line 267 on the other budget, sits us at 9.8 million in reserves, cash and investments. So both of those are in line with our budget.
One is the 7121 is actually at the top of the band that trustee Kent referred to last week for the reserves. And 7450 is above that for reserve.
Indeed, yeah. So I wanted to just use that as a starting point. Michael and I have been talking about just doing some projections, looking ahead over the next few years. Michael, I'm happy to speak to that, or would you like to start? Excuse me, you want me to speak to it?
Since I went ahead and typed this up,
Please.
Now you're gonna talk about this.
Correct. But
I'm gonna
Michael,
set, I'm gonna just set up. You know where we're at. Looking at those two numbers based on the consensus that we are at this moment. As treasurer, I've been moving on this a lot. I wanted to share my thoughts and concerns about how our millage rate is going to impact the reserves moving down the line. We know what next year will be based on, or at least as of a graph in front of you. Based on that, where we stand right now, expenses, if we go with the rollback millage of 0.7121, it shows that we can fund every program at the current consensus level. And I'm not suggesting that we do. But we can. We'll still need to take 2.3 mil out of reserves, leaving 9.85. And as I said at our last meeting, that didn't sound so awful. However, if we do that to maintain those funding levels a year from now, no increase in any current programs funding, no new programs, and no out of cycle funding, we would have to again take 2.3 out of next year's reserves, which would lower them to 7.5, which in that year makes us out of compliant with our reserve policy. However, that doesn't account for our decrease in ad valorem taxes. If Amendment 3 passes in November, that passage would further decrease our reserves. And additionally, none of this accounts for how much the recently passed legislation will cost us in future years, as we could be forced to move to the rollback rate if we don't have 5 votes to override that limitation. A lot of variables, I understand that, but there's a lot of ways that will impact the bottom line coming to reserves that I feel strongly about protecting. If you extrapolate that out for a couple of more years, we'll be out of reserve funds altogether. To meet our mission, vision, in support of the health of the citizens that we are here to serve, and those needs are not decreasing, I find this path that we could put ourselves on to be completely unacceptable, inappropriate, and inexcusable. We need to find a better solution. That's why I'd reached out to Frank, and he'd been doing his own noodling on all of this. What I wanted him to do was really do a detailed analysis, looking at the real numbers, what the property appraiser says we're gonna have, what we're going to lose over the next 2 years, et cetera. And asked him to take a peek at how the 0.7121 in particular impacts reserves over the next 2 to 3 years. Now you can find.
thank you, Michael. So you see before you, you have 3 pages stapled together, and then you have a paper clipped walkthrough. I'd like us to start on the first of the stapled pages, and I just want.
Hold on.
Okay,
When are we at? This one?
correct.
Thank you.
Is there a copy available to the public?
No, not at this time.
No,
Well,
yeah, we
we
can make
can
it.
make one. Just was produced this morning, so.
So let me just orient everyone to the sheet. The sheets are the same. The 3 sheets are the same in terms of structure. So let me just walk you through. So the first sheet is if we set the millage at 7121 with some other assumptions. The other assumptions are there's no year-over-year increase in expenses. There's no year-over-year increase in revenue, because the other assumption is that we stay at the rollback rate. So we stay at the rollback rate for this year at 7121. Then if you look across on line 9, The rollback rate for for the subsequent year, assuming homestead exemptions are in effect, goes up to 7,884. The following year, they go to 8,450. Why does the millage increase? It increases because we're taxing less dollars. So to maintain the same revenue level of 24.15 million, the millage has to go up. So investment income on line 12 stays even in all these scenarios, okay? And you'll notice when you look at lines 13 and 14, you'll notice that the revenue is the same across all projections for this year and the two subsequent years. Expenses are the same. Expenses on line 15, you can see are, frozen at 0, as I mentioned. And to Michael's point, we're gonna keep level revenue, level expenses, so 2.3 is gonna come out of the budget every year. So that being said, assuming there's no out of cycle funding, there's no additional funding, so no matter what happens for need, opportunities, anything like hurricanes, whatever comes up during the year, we will have no ability to be able to fund that. Otherwise, the reserves will be depleted quite quickly. And you can see on line 21 that we'll go down to 7.3 million and 4.9 million. Why does it make sense to project a couple more years out? Yeah, but I mean, we have no idea what's gonna happen for FY 29-30. So even these are projections, but this is as close as we can get to what this reality may look like. I want to just draw your attention to line 4. These numbers I didn't pull out of the ether somewhere. I worked, the property appraiser's office has been absolutely fantastic. And so we worked through a lot of different scenarios and these are numbers from them. So this is not something I just made up. Let's turn to sheet 2, please. Sheet 2, same structure. This is us keeping our tentative millage at 7,450, but the same assumptions apply. We're going to use the same amount of revenue, the same amount of expenses. We're not going to be able to raise funding for the next 3 years to any organization. There's no off-cycle funding, none of that. You can see how that's kept even. What's the difference? Look at line 16. Instead of 2.3 million cutting out of the budget, we're only cutting 1.2. Do our reserves still deplete? Yes. They just do it as a slower rate. This does keep us compliant with our policy at least through 28, 29. After that, who knows? This next scenario, which is probably the most realistic. Because otherwise, we're assuming that we're not going to absorb any inflationary costs, no matter what happens with the economy, we will have no ability to be able to provide any more funding to the organizations that we fund for the next 3 years. So any increases have got to be a no. So let's look at this scenario. We stay at 7,121 at the rollback. The only difference here is line 15. If you notice under the FY 27, 28 and 28, 29 projections, I put inflation at 3.4%. This is our current inflation rate. Could go up, could go down, but these are the numbers I'm working with, in our reality now. Well, what does that mean? Look at revenue less expenses. Well, we go from 2.3 million this year to 3.2 million coming out of reserves the following year, 4.2 million coming out the next year. So you can see our reserves be depleted. We're sitting here with 9.8 now, which is great, but then they go to 6.5 and 2.1. 2.1, as you know, is our burn rate at a budget of $25 million. That's 30 days cash on hand. So I'm just going to stop there to see if anyone has any questions.
Can you speak to the 3% annual increase in the gross taxable value?
Oh, yeah, I will. So I'm sorry, this is the same in all sheets. Let's go to line number 3, please. Notice in the FY 26-27, the gross taxable value increased by 6.5%. If I look over the past 20 years, given the financial crisis of 08 and all that, the average is about 5%. So I talked to the property appraiser. The number that they consistently use, their safe projection is 3%. And so that's directly from them. That was a recommendation to property appraisers. On 5 or 6, maybe too aggressive. We've had some years, y'all know, after COVID, where everyone's moving to Florida, where we've had 10, 11% year over year. But then during the financial crisis, we've had 11-12% losses. So this is also assuming a 3% growth rate, which we don't know, but it's the best number we can use for the projections.
Yes, I'm sorry, I'm studying numbers. Karen, Trustee Deagle.
So do the reserves that are listed here include the sale?
Yes,
Okay.
everything.
How does it, being that we are down one trustee, and probably will not have anyone new until 2 years from now, affect our voting, our ability to increase, or lack thereof, in the future? I think we're limited now, aren't we?
Exactly, and that's, I wanted to put in two constraints. I mean, we have to, to follow our mission, we have a responsibility to make sure that this organization, like any other organization, is sustainable. So a big part of that is looking at the constraints and seeing how you can manage within those constraints. Facing homestead exemptions on their own, we can manage through that. Facing the voting challenge now with 3/4 being 5/6, which mathematically doesn't make any sense, but that's the way it works for us. We have to assume that we're gonna not have another trustee for 2.5 years.
Correct.
And so we're gonna be, we're not gonna be able to move beyond the rollback. And so that we could probably manage through. But these two constraints combined creates a situation where this is the only reasonable way to project what our financial future looks like is page 3. And whether you flip the 7121 with the 7450. If we assume that we're just gonna give inflationary increases in funding every year, that still is gonna put us in a really tough spot. So to your point, Karen, I have to plan for that. I think it's a reasonable scenario to think we are definitely gonna be at the rollback rate for the next 2, maybe longer years. Correct, if we don't have 5 votes.
We need 5 votes.
Correct.
Right, you have to have
Yeah.
a full 5 votes to do it. That's correct.
Trustee Mackett.
Yeah, Dr. Mackett speaking. Thank you, Michael, and thank you, Frank, for that analysis. Very detailed, and I think it's well thought out. I do, though, have a couple of different opinions on some of the assumptions in there. So I'm gonna throw those out there for consideration and discussion. The biggest assumption is that if Amendment 3 passes, and 3-4 months ago, I was very certain that Amendment 3 would pass. I'm not so certain now. And the reason I say that is Governor DeSantis is not championing it. And the number of groups in opposition to that continue to grow and are very vocal. So I am not certain that it will get to 60%. Right, so I think that's a big assumption. And to my knowledge, the candidates for governor, Byron Donaldson, has said that he supports property tax reform. But he said he would do it in a way that has less impact on local governments. So that if Amendment 3 does not pass, I think we are likely to have property tax reform if the governor is a Republican, but with less impact on counties and local government and special districts. I believe, I could be wrong, that the Democratic candidate, David Jolly, does not support any property tax reform. So I question that big assumption right there that Amendment 3 is going to pass. That said, I think the property owners in Florida would like to see their taxes stay the same or go down because affordability is a huge issue for everyone. The second assumption that is that spending stays flat through all of this, and that the reserves reduce, right? If I look historically, I think I'm right, I'm probably wrong, but I think I'm right that revenue has increased every single year. Over the last 25 to 30 years, the revenue hasn't gone down. And trustee Westcott has made this point several times, that revenue continues to increase. What has increased dramatically and has outpaced inflation is our spending. Not to say that expansion of programs isn't a good thing and necessary for the community. But spending has increased dramatically, right? And I think the assumption that spending stays flat, if if Amendment 3 goes into effect, I think that's a big assumption. Because I, as a trustee, would expect, and I think our agencies should expect, that if we get $2 million less, there is no way our spending is gonna stay the same. It's gonna have to change.
Dr. Mackey, let me be clear, because there's one thing I just don't want to confuse anyone about. The reason I'm saying that revenue is gonna stay the same has nothing to do with Amendment 3, it has to do with the votes. Meaning,
I understand.
yeah, okay.
Yeah.
So that's the assumption I'm making. This constraint now, effective July 1st, has not existed for the past 65 years in our
I
organization.
understand that.
That's where I was
I
going.
understand that. And I'm trying not to filibuster here,
Right.
but I want to address
Right.
the assumptions. So I think there is an alternative to spending staying flat and revenue staying flat to those assumptions. The first is that as a board, we could reduce spending, both for agencies and our administrative costs. The other thing we could do as a board is we could go to the taxpayers in a way that we did with maternity care and have town halls and see what the taxpayers think. Do they want to increase taxes to keep spending level or increased, or do they not? Right? And I think I would leave it up to them. The third thing is the reserve policy. Right? We assume that we're gonna deplete the reserves and that the policy remains the same. Although I think we've had a discussion around here that some of the way emergency reserves and reserves are structured are duplicative. So who's to say that our reserve policy remains the same? Maybe it will, and I probably would support that, but I don't think that's a given either. And the last thing is the GTV growth, right? You're assuming that it's gonna be 3%, right? That's what the county is assuming. That's probably a really good estimate. However, as you stated, there have been several years recently in the last decade when it's been higher than that. And I just read that the DMV said at the first 6 months of this year, more people from out of state got driver's license in Florida than any other year. So I'm not sure that assumption will bear fruit. People are still moving to Florida. Why? They're fleeing places with higher taxes and more difficult challenges with cost of living, crime, etc. And if we are going to remain attractive to patients from out of patients, maybe they will be patients, to residents from out of state, I think we really have to look at our tax rates. So that's just my opinion on those 4 general assumptions.
Karen, I saw your hand go up.
This one's, it's a tough one, and I heard you say the word, Dr. Mackett, several times, assumption. And I think that's the hard part of this whole year, is that everything is an assumption, and when there are assumptions in business, I always look at the worst case scenario, and how are we going to overcome the worst case scenario? And so I would want to make my decisions on how we can best manage those assumptions. And to me, by decreasing down to the 0.71 would not be doing that. For the small amount of dollar that it is, and with all of the assumptions that we're working through, I think it would be very, what's the word? It would not be prudent of us. And yes, it would be very risky, thank you, for us to leave it at 0.71.
May I just say thank you for letting me just walk everyone through this, you know, in conversations with Michael, I just feel that I would be negligent in my job if I did not bring this to the trustees'
Absolutely, I
attention.
appreciate it.
Trustee Kent.
Was it Mencken? You'll never go broke underestimating the intelligence of the American people. If I walk into a voting booth and see an amendment that says, hey, you want to pay less, I get where Dr. Mackey is, I do, and I haven't got any sense, I've kind of assumed from the beginning, the get-go, that it's gonna fly. We don't know, even though there are a lot of, and I understand why, I guess, groups that are out there against seeing that pass, we just don't know. Again, one of the phrases I used here was, I just know we need to find a solution, we need a better path. And I think it includes a lot of things. Number one, and randomly, we've got those asterisks. Are we gonna go back and look at them? You're damn right, that's happening today. And we may have to go back and look at non-asterisk items as well. Should agencies already at this point in time be thinking about how we're being impacted, therefore how they're being impacted?
Absolutely.
You're damn right. That's smart. They should be doing exactly what we're doing, taking a very hard look at what the next 2 to 3 years could bring. Should the policy in reserves be readdressed? I'm fine with that, and I think that there probably is, if my take would be there's probably $1 to $1.5 million there that we can back out. Because they could kind of be construed to be redundant, overlapping. So I mean, there are any number of things we might do. The bottom line is, one of the first things that I hadn't thought about in terms of what the actual millage would be. The rollback rate is gonna go up. That's sort of counterintuitive, but you've got to think it through, but I mean, it's just math based on, you're gonna stay level in terms of the dollars that you raise in ad valorem tax, so do the math and there it is. And in 3 years, we could be at almost 8.5 mils, under. That's gonna vary, the scenarios will. I'm not sold on anything, I think it's less dangerous, I don't know if that's the appropriate word, but it's less, it's harder if we go with the 7-1-2-1. I'm not absolutely advocating for the 7-4-5-0, but I think that's part of the discussion. We gotta look at the numbers, figure out what's there, and move forward from that. I think there are a lot of things that we have to do to get to the bottom. But I was concerned. I mean, I voiced that last time, but then I thought you better look at these numbers. And I appreciate the fact that Frank pulls that together because we've got obligations.
Thank you for doing
Trustee
that.
Westcott?
Yes, I'm not gonna repeat everything that Dr. Mackett had to say, but I concur with him. One point I was gonna make specifically, Mr. Kent just made, which is that I do think this conversation has put us in a position where, as much as I appreciate the work that the committee did in putting together our reserve policy, I think there is margin there for reduction of that requirement based upon overlap. Refresh my memory, the way that the amendment is structured, any increase beyond 10% requires a unanimous vote.
Correct. Which we can never have.
Right, until, however, up to that 10%, it's just a super more majority, given the present number would be 5. So that 10% would take us to a millage of 0.7833, if it proved necessary next year.
Well,
So-
we can't, because we've already approved 7450, so.
No, I'm talking about the future budget years. In other words, next year, there's a 10% margin that could be put on top. Again, I'm still inclined to the lower rate. And I think that the history that Dr. Mackett referred to is why this item is on the budget. That the narrative that has been created in the past few years is population curve is growing much flatter than everybody's budgets because the property values have universally increased. So it's relatively easy money to spend, not remembering, as I mentioned last meeting, to some degree, our tax burden is an indenture. Every dollar that gets paid in taxes has to be earned. It has to be earned at the workplace, and that's that many hours of work that has to be produced, taken away from the public in order to generate that money. So, thank you.
Trustee Jones?
Thanks. Yeah, I appreciate all of these comments, and I'd just like to make, and I agree with all of them, and it's really hard not to disagree with any of them. We got tough stuff to do. I suggest we start now. And by that, I mean, well, first of all, I think we ought to make this point, that in the last 10 years, the millage at the hospital district, if we go through 0.7450, will be down about 25%. That doesn't mean revenues are down, as we all know they're up. But the millage is down. And I think that gets lost in the work that the district has done. Secondly, right now, we're going to have to take 2.3 million out of reserves in order to fund our budget at the rollback rate. I think we should work on how we're going to do that right now, not wait for a few years and defer it. I think we ought to go back through all of the line items that we've approved and see if we think it is in the public interest to reduce spending by 2.3 million or some amount in between. And I think we'll do that now. It's easy to talk about how hard it is to manage these funds when we're talking about what people might do in the future with all kinds of assumptions. But I think if we're going to, as Dr. Mackett pointed out, we're going to start trying to reduce funding, let's try to do it now. And if we find we can't do that, then we can make decisions about the reserves. But I think we're going to do it now, and I'm going to work on that. I have been working on it since Frank got me thinking about this, and I think we're going to try to do it now and reduce the amount that we reduce reserves as much as we can. And then we settle on a millage, which is going to be between 0.71, 0.74, and see how we go forward. So that's my comment.
Thank you. You want to start with the asterisks? Those that we had.
Oh, let me make one more comment. I'm sorry. And that is that, we've got agencies coming asking for more money this budget. So when that happens, whatever we do there is going to increase the amount we're taking out of reserves. It's not going to be 2.3. It's going to be 2.5 or some, well, the actual reserve number will be somewhat lower. I didn't say it properly. But we got to keep that in mind too, which is why I think we ought to get to work right now and see how realistic it is to cut the budget. Because it's pretty easy to say we're going to do it. And we should have done it in the past. But I think we should start now. And yeah, I think starting with the asterisk items is a good part. We've got agencies coming forward asking for more money to finish this current fiscal year. And then I think we have consensus on all of the different programs, and maybe we could review that and get just a little more disciplined. I think I used the word frugal before. I think we're trying to achieve that.
Okay. Everybody's got the sheet in front of them that has the asterisk items from our last two budget discussion meetings.
What Jenny put together.
Yes,
Yes.
correct.
That's
Somewhere you've got that right there.
got it.
Okay.
We need to start using different colored paper. Today we can do.
Yeah, bad.
You're right, forget it.
Maybe put something on.
Okay, the first one, that we'll talk about is Healthy Start Coalition, particularly the lactation, program. Jenny, is there anything that you can summarize in the,
Well, I can read the paragraph where that the requested funding increase was not accompanied by a comparable increase in the estimated number of clients to be served. Specifically, while the budget was projected to increase by approximately 68%, the estimated number of clients served was projecting to increase by only 6. We did determine by speaking with Ms. Fall that they are anticipating adding an additional staff member to have 24/7 lactation services, so they do feel that the client served will increase, the encounters will increase. And a placeholder was set at the 120,000 with the understanding to come back and discuss it further.
and 120 is what they had asked for.
Let me go back and.
Right.
Yes, that is correct.
Okay.
And I just want to point out too, I did put it in the narrative, but you know, their approved budget for this current year was 68,000. They saw the need increasing, and so they did reallocate funds from another program, an additional 20,140 to support that program to a tune of 88,140. They are surpassing that. Annualized projection is surpassing that now. So looking at about 99,000. So the 120,000 is a little above that.
Yes, trustee Kent.
Did we asterisk this particular program because we thought it could be cut, or because some people thought it should be expanded? Remember the
Trustee Mack.
particulars.
Yeah, Dr. Mackett speaking. I was one of the ones who questioned the 68% increase
Yeah.
with only a projected increase of 6% in the encounters. And Frank, maybe you can inform this. I don't think the number of births in the county has increased 6%.
No.
It is either remained flat or dropped. So while I understand it might be nice to provide 24/7 coverage, in my mind, you can probably provide lactation for people with less.
What's that?
Yeah, so, I have a 2-week, 3-day-old granddaughter that was born at Cleveland Clinic.
Yeah.
And, program is awesome. My daughter felt very supported and helped, no doubt, no doubt. And this is probably an area of me being a little ignorant and also putting my nose where it doesn't belong. But as I was watching, the nurse staff there is wonderful. And I'm curious about any efforts at collaboration with well-trained, dedicated nursing staff at bedside to bridge that 24/7 gap as opposed to bringing somebody in full-time.
Trustee Kent.
Just to go there, and I went there the first time around, I was kind of where Dr. Mackett was, and, my funding number was 94,000, which was 50% of the requested increase. Just to give you an alternate number to kick around.
Trustee Deagle, did you have something or Mike?
Yeah, I thought I did, but
Okay.
I guess, you know, this is where I'm going with the dartboard again. And it's like, we don't have a, you know, a reason to say we should be cutting everybody by 10%, or we should be doing, you know, because we're making up stuff here. And I'm kind of concerned about it, how we're gonna go down this whole process and say, well, okay, this is the first one, so let's cut them like $20,000. You know, why? We don't have a real reason why, and how are we going to do everyone else and get to what Michael, and I took his point very well. Or I'm sorry, not Michael, your point too, but Alan's putting up there. Alan's point of, you know, we need to, if, you know, I agree with reserves. I have a hard time using reserves to fund operations. Reserves are supposed to be there for reserves. It's not supposed to be there for operations. So, you know, I am challenged as to how much I would say we need to cut each of these asterisks in addition to how much we're going to and how we're going to, you know, get this number down. I don't think I made any sense there, but it felt good to talk. Okay,
We're here for therapy.
thank you.
Trustee Jones, anything that you'd like to add to this conversation?
Well, I don't think I'm supposed to comment about Healthy Start, so
Okay, good point.
Okay,
I
thank you.
thought there was somebody that was
Thank
supposed
you,
to be shut out.
So this is Paul Westcott. If we use the 88,000 that was realized,
Mhm.
and multiply it by 106%, which allows for the 6% growth, I think that maybe that puts us at 93,280.
Mhm.
And yeah, I think it's completely appropriate for us to be looking under the cushions to find nickels and dimes today. So 95, I'm not sure where you all are, but and we're not cutting, we're still raising. We're just not
reducing the
raising,
increase.
we're just reducing the increase.
Very eloquent.
So is the.
Michael made a recommendation of 94.
Mhm.
And given the facts that we have, I can support that.
And we're still just building consensus on these numbers, correct? Right?
I think at this moment, we're essentially.
Yeah, we need a
Okay.
final today.
Okay, so, is everyone comfortable with 94,000 for the lactation program? Okay. Thank you. Okay. Mental Health Association Parent Child Center.
Okay, so trustees discussed. And marked it with an asterisk due to the significant budget increase request for 26-27. It's a 31.6% increase. The request is from 395 to 520. I will give you some more accurate numbers according to the last. Invoice processing as of July 31st, which was 10 months into the fiscal year, MHA has served 3,842 clients and has exceeded their program budget by 51,000. Their annualized run rate for encounters at the Parent and Child Center is 4,610. The projected annualized budget for the parent and child center is $535,692. So that just gives you kind of where they are compared to what their request is. I also wanted to bring to your attention that they are coming tomorrow evening to request additional funding to support this program as well as the walk-in center, which they're running over as well.
For current year. Correct. Trustee Newell.
So just to verify, this is the parent-child center one, right?
This is the one that was asterisk, yes.
Okay, asterisk one. Last year it was $395. Their year-to-date annualized projection is at 537, or basically 538. They've requested 520. We recommended 495,000 with an asterisk. But they're coming back asking how much?
190,000 for their complete budget, total budget,
An additional 190,000?
to get them through the next 2 months.
To get to 535.
To get, it's a combination of their total budget that they're asking 190,000. They didn't break it down per program.
For all programs, 190,000.
This is Paul Westcott. One of the trends that I'm not sure if I got this number. I haven't done the math recently. Michael, you probably, 74% of the funding comes from the district for this program. That,
76.
76.
Yeah. Well, their request would be 76.
Right, but our experience is currently
Right,
is 74%.
right.
I'm just concerned about a trend.
Very high.
Mhm. But then we would have to go on that, this is the same thing that I'm talking about, is that we would have to go through and look at every one of the funded partners and figure out, and maybe we should be doing that, since we've got, not today, but we should be finding out what the percentages that we are paying for of a program, and that we come up with a decision that we will only pay 50% or 75% of any, and then go through and it's one more formula.
Well, Paul Westcott again, but I think this question is part of our criteria.
Mhm.
So why not?
Yeah,
That's good.
same thing, trustee Mackett.
Yeah, Dr. Mackett speaking. I was gonna say that same point, but I was also gonna point out that trustee Kent has weighed in on almost
Yeah.
every proposal with that
Similar
particular
data.
point, what percentage of funding that we provide.
And trustee Kent recognizes it's kind of impossible to just say, we're not,
Right,
black and white does
Right.
not work in my
No.
world most of the time. I'll use the extreme example. We're gonna go to a Cleveland Clinic and they're $2 million in maternity support. And say, sorry, folks. We've got to make cuts somewhere. Everybody's gonna get hurt. Maybe we will. I'm just saying, those are tough decisions when, we're not 100% of the budget, clearly. The big number. And it's hard to know. I do point it out because I want us at least to be cognizant that we're paying a lot of the bill. The hospital district is never the last resort
right.
for agencies, for our partner agencies. We're always the first resort when things are difficult. And I'm always fighting internally how zealous I should be about mission vision
I know.
in terms of need versus the reality of these are taxpayer dollars. And I know what some people might think that I'm leaning too hard one way versus another, but that's our challenge.
Trustee Mackett.
Dr. Mackett speaking, given that conversation, I am comfortable with staying with the $100,000 increase from last year. So the tentative approval of 495. And I would be looking at additional funding to fall somewhere south of that probably this year.
Okay, so we have a $495,000 on the table.
Which is what we had said initially
Right.
with the asterisk, so we just remained the
And
same.
I think that was purposeful based on growth of clients and.
Trustee Jones?
I think, well, I'm really torn on this because I think helping kids with mental health is a vital impact in our community. And the fact that there's more kids needing this help speaks to how important this is. So I think I fall in around the 520 area. That's what they've asked for, and I don't want kids not to have this coverage. Now, we could go back to them and say 74 or 76% is excessive and you got to find some other revenue sources. But this is imminent. It's happening right now, these kids. And from what I read, it just happened anecdotally to see a CDC study that across the country, 40% increase in children with needing mental counseling. So I'm sticking with the 520. Thank you.
Okay, so we've got one for 520. Do we have more for 495? More?
495.
495.
Same for me, 495.
I think that's
That's-
4 of us.
I'm with 495. That's what we
Okay.
came to at the last meeting and with the asterisk, and the asterisk meant that we were looking at decreasing it again potentially, and so I would be willing to stay at the 495.
Thank you. All right, Mount Health Collaborative.
I have to recuse myself.
Oh, thanks. Okay, Jenny?
Okay, the reason for the asterisk on mental health collaborative was because of the large increase from this year's current budget of 260,000 to the request of 310,000 for next year. And because their current run rate is only, that number is changed, I think. How about that? But their current run rate was significantly less, so it was questioned, and it was, let's put an asterisk here to look at. I do recall that during the public comment, Wes did speak to the reason for the increase. As of July 31st, they've used 70% of their budget with 2 months remaining, and so raising the question of why there was such a large increase. But he did state that with the opening of the crisis stabilization center that Thrive will be opening, he felt that there was going to be a need for, there was gonna be a larger encounters for next year to support his request.
Comment, discussion?
I mean, we landed at 260 and I was comfortable with that in the end. I accept they are probably going to see a significant increase.
I agree.
I agree.
Trustee Jones?
I agree as well.
Okay.
It's 260, right?
Right, yes, sir.
No, that's.
Okay,
All right.
can we bring Dr.?
Oh, yeah.
I'll get it. Where did we go?
Probably Frank's office.
We need to have a whistle.
Yeah, really. Little bell.
Yeah. Hey, you.
Hilarious.
Right. Right.
All right,
Thank you.
the next one was New Horizons for the inpatient unit. This is the children's crisis unit. That they requested 584,000 for. And it was asked for additional discussion. There was some questions from trustee Westcott regarding the run rate of Indian River County residents, which I did provide in this as well. And so it was just brought back for discussion.
Trustee Westcott, what about the data that is provided? Is that helpful?
Yeah, so. If my memory corrects, one of the other topics that came up was the number of these patients that actually have insurance as well. Was that? number-
That was
What was
stated.
what was the number?
I didn't, she
Percentage?
didn't give a percentage, she just said that there was a large percent of them that had insurance.
I believe it was over 80%, but many of those children have Medicaid. Right.
Some other source of
Coverage of
payment.
Medicaid.
Yeah.
So we had tentative consensus around 584. If anything has changed with that?
I will note also that New Horizons will be here tomorrow evening, I know we have to have a budget by. Will vote tomorrow,
Well, yeah,
so.
we need a millage rate. And so I can get these ads to
Right.
TC Palm, and so you all can change some budget lines after September 3rd. And vote up to approve it on September 8th. So there's some flexibility between the 3rd and the 8th, but I need some consensus on numbers now. But you can change them after the 3rd. So I don't know if we need to have another meeting that day or what, but that's where the flexibility lies. That final budget on September 8th, the line items can change. You just can't change that millage rate. So it would come out of reserves. I don't know if that makes sense.
Is this the number of bed nights or number of patients?
That was bed nights,
Bed nights.
that was an encounter.
Okay, so-
Bed night.
Yeah, the number of patients is much smaller.
Yeah,
Mhm.
so if we.
Comes
Use
out to
last
800
year,
A night,
Yeah. Which is pretty inexpensive.
Mhm.
$100 an encounter.
Do you know the average length of stay?
Yeah, it was 4 days, an average of four nights, at least.
if,
But divided by 4 roughly.
well, so
180.
how many patients are they anticipating
I
to get their number?
think it's like 180 if I do.
Because if I
poor
take-
math, but
If I take the 339 nights for last year. And divide that into 584,000, I get $1,700 a night. So it's like twice what we would anticipate spending.
so they're saying 730 encounters. And
yeah.
at 4 averages 4 nights per person, so you're looking at 182 people.
So Indian River County. The experience in the last 3.5 years, the worst year was last year at 339. So I think there's room on this one for us.
Well, it was 380, did you say 389 here?
339.
339, and they're moving all of them to New Horizons because they're not gonna have the P program here, right?
Right.
So so if they're only asking for 182 persons, what did you say, 339 nights?
So if I take,
Or
if I take 584,000, divided by 330 nights. I come up with $1,700 per night.
But they're
They're
saying their
asking for
encounter is 8.
Yeah.
800.
800.
They're expecting 800 nights.
No, they're
No.
expecting, it's 800 per encounter. So they're expecting 730 encounters, which means 730 nights.
Nights, which
And
is.
one person usually uses about 4 nights on average. So that's where I'm getting the 182. I divided
What-
730 by 4.
Right, what I'm trying to figure out is where they're getting the additional patients. I'm using Indian River County as a data point. And their worst year was 339
Nice.
bed nights.
Mhm.
How do we get to more than twice that?
It's not. Oh, I say 730. How do we get from 7?
I guess what we don't know is
Well,
what the underserved.
And I
is.
thought this was patients, 339.
Patients? Okay,
Yes, that's how it was
Okay.
requested. And
Okay,
it
well,
does
it's-
say
it's not nights, it's patient.
Resident.
that's actually, yeah,
So
that's
that's-
very different.
339 patients.
Okay.
And again, they're serving 4 times?
Yeah.
And again,
And there's only
it's
20
one
beds.
of those, yeah, it's one of
But
those
this is
things
just-
too that
Yeah.
it's by encounter. If they don't use
Well,
them.
I
they
just,
don't.
I just want whatever we're going to allocate to be based on real data. And so now I understand it.
I'm
But
good.
if these were patients, not nights, then
No, these were patients.
Okay.
That's how it was requested.
Thank you.
Okay,
I'm good with the 584 myself.
trustee Jones,
I'm good with the 584.
okay. Everybody else? Michael, trustee Fett?
I don't have a number, I'm just. It's such a. I understand things are completely different here. It's just such a huge increase, obviously.
But we're also moving from behavioral health to New Horizons. So even though the increase is here, did we get decreased?
We did.
We did. We got the decrease from the behavioral health center. So it's a shift.
What goes through my mind is, are there gonna be beds? There's only 20 beds there. If they meet 339, whatever the number is. Does that mean a bed's gonna be open? I mean, I'm not sure they're all gonna end up here. We're trying to underwrite the full cost. I don't know how, I'm not doing the math with you as you've been doing it, I'm sorry, but. Are those beds gonna be there? They're gonna end up needing to go someplace else. There aren't a lot of other alternatives, but farther south, there are some. The other thing that bothered, and I've said this. To I guess when they were here last time. It just bothers me that there's no other local organizational funders. They don't fundraise.
Right.
I know how challenged they are with staffing, just to meet the professional medical needs. Nonetheless, a nonprofit in this day and age that's not pulling that string concerns me some. And I don't want to be the first resort again to cover everything. And again, they're coming tomorrow.
Trustee Wilson?
just to address, Michael Kent's. Using the 20 beds, we're gonna account for theoretically 18.6% of their occupancy.
Okay, trustee
Do
Deagle.
we know if they're able to fundraise? I don't know if they are. Are they a 501c3?
Mhm.
They are, okay.
Yeah, they used to have a fundraiser. but-
Yeah, a long time ago, it's been a while.
Mhm.
There's turnover with leadership.
Mhm.
Yeah.
What's your number?
I don't have a number, I mean, I'd rather it not be 584 if we can knock that down a little, I mean, it's just absolutely arbitrary in my mind, 500.
I would support 500. Trustee Wilson
I
is
could
not,
support 500.
trustee Mackett, okay? Trustee Deagle, trustee Jones,
Sure.
500,
Sure.
trustee Jones,
Oh, okay, I mean, because they can come back and ask for more if it's fee for service.
Exactly. Yeah,
That's a problem.
Okay, 500,000.
Um,
Correct. Oh, sorry, yes.
Yeah, Dr. Mack is speaking. I would just ask us all to keep in mind these numbers we've got consensus on when these agencies come requesting more funds.
Correct.
So
Yeah. Same.
in my
same
mind, I'm not
discussion.
thinking we should probably fully fund the
Correct.
requests. If we're
Yes.
not fully funding their
Mhm.
next year.
I will concur. Okay, Karen?
Leave.
Yeah.
I didn't know if you were gonna ask me a question or if you're picking me out.
I switched to Karen, so that's what your CEO hat on. Okay, we have 2 programs here, correct?
Well, there was a little confusion here. I had 2 programs, but I think Frank had 3. And when I look back at the minutes, we did discuss all 3 programs. So if I could just kind of go through all of them.
Okay.
I'll go through the minutes because it was a little bit more clear. So the first request for review was the emergency Meals on Wheels.
Mhm.
And I did have that, or that, excuse me, I did not have that one. Yeah, I did not have that one asterisk. No, I did. I'm sorry. Forget it. Excuse me. Let me start over. Okay, so the request was 85,094. That was the approved budget for this year, okay? So they requested the same. Hold on, I'm getting confused here. It was asterisk. Do you recall what we? Let me read through my notes. Ben. Let me refresh my mind. There was discussion because, I'm sorry, well, there was discussion because last year that was part of the sunset. So we did not approve any invoices over that. So they reached their capacity. That's what I was forgetting. And now I recall. So, so that was part of the question was whether we're going to still.
Yeah, so this is emergency.
Yeah.
I'm sorry. I'm sorry.
It's on page 3 of
Yeah.
your,
Yeah, no, I got it. I'm
Okay.
sorry. Let me just start at the beginning.
Emergency.
Scratch all that. All right. So we revisited their previous approved sunset funding for the Meals on Wheels. Can we start with that just because that's the order I had asterisk? Okay. I did not have emergency on Wheels asterisk, but so trustee Jones and trustee Kent both expressed that their perspective had evolved regarding the importance of nutrition as a component of healthcare, food as medicine, and indicated they no longer supported fully sunsetting the Meals on Wheels program. While they did not support fully funding the program at the requested amount, consensus was reached to continue funding Meals on Wheels at 50% of the prior year's funding level, which is the 504,140, consistent with the previously established sunset schedule. Trustee Mackett stated that his preference was to continue with the original sunset plan. That's Meals on Wheels. So can we just start with that one? So we kind of were coming back to decide whether how we were going to proceed with the sunset plan.
Okay, let's do that.
And my recollection was we bifurcated those 2 issues, funding
Right.
versus do we
Right.
sunset it or not, and said we can come back to that
Correct.
at another point in time, and which is
time.
This might be the time, you know.
could be.
Well, I don't know that the sunsetting has to be done to. A discussion on the sunsetting has to be done. It's a question on
That-
funding.
Correct.
That's what I was implying,
Right.
but if
Right.
others feel we ought to just decide it now, we can hash it out. I think we can delay
I think we
the
can go ahead.
sunset.
Yeah, yeah.
And with that said, was comfortable with where we ended up. At 504.
Mhm. Trustee Westcott.
I think that was our commitment last year, so I'm fine with that. I want us to adhere to what we said last time.
Trustee Jones.
I just want to make one correction to the notes. Probably miscommunication because I was zooming. But my thinking hadn't so much evolved as I thought last year we should not sunset this. And I recommended 471 because that's what they lost from the federal government subsidy, but that we would not sunset it. So I've been in that position for a while. We ended up giving them 785 last year, I think. Now we're at 500. And Michael and I pretty much agree that we ought to kind of settle at that number. And I think that's a good number. So I'm going to support Michael's, was it 504, Michael? I can't remember the exact.
140. You're a wise man, Alan.
Okay, so we're in consensus with 504, 140 for this year, sunset to be discussed at a future date. Okay,
Okay, so I'm gonna jump back up to emergency meals on wheels now that I've got my notes here. So trustees also asked about the utilization trend for emergency meals on wheels program. The emergency meals on wheels budget was approved at 85,094. However, mid-year reallocation request. Let me just make sure mine, yeah, was approved where they moved $40,000, where they received another $40,000 and we making their budget. Yeah, no, they took it, yes, I'm sorry, they reduced it by 40,000 and they making it 45,094, okay. As of July 31st, they are trending under the reduced budget for that program. So there was a public comment by Ms. Orzel. She had explained that the Cleveland Clinic had declined, their referrals had declined from Cleveland Clinic, and they have hired someone, a staff member dedicated to increasing community awareness of the program and anticipates referrals will increase as outreach efforts expand.
Who hired someone? Hospital or?
No, senior resources to do some
Mhm.
awareness. So that's where they're hoping that they'll increase the encounters for the future.
and so it looks like we had some consensus around 85,094.
That's
Was
what the
that
consensus
correct?
was, that is
Okay.
correct.
Which was the request level.
That's the request.
Right.
level.
Right.
78% of that, this is Paul Westcott,
Uh-huh.
is 66,373.
Okay. Until July 31st. Okay, so what are they trending? Do we have August numbers? No, we're still in August, Gary.
Yeah, I don't have the actual
Yeah.
numbers, but I do have that they were just trending under the reduced
Okay.
Yeah,
budget.
through June it was 42,075. Do we have through July? Shannon?
So through July, their total expenses, this is not annualized, this is what they've spent in 10 months, is 35,448, which is 78.6% of the 45,009.
So it's still 78%. I like Paul's number.
66,373.
66,373.
Trustee Jones?
I agree with that.
Okay.
I agree.
You did, okay, great,
Utilization.
okay. 66,373 for emergency meals on wheels. Okay, here,
Okay. The EARS program was also one that was on a sunset path. Let's see, it was scheduled to sunset, on next year, 9/30/2027.
right,
Let's see, it was approved at 65,750. However, a mid-year reallocation request was to reallocate 14,000 of that to help support the Meals on Wheels program. So their budget ended up at 51,750. Their annualized, I don't know if I have the current numbers, their annualized budget as of the last. Do you have the annualized numbers for?
I have through June.
Yeah, I have through June too, so it was 38,160, so they're still under budget there. And their amount of their request for next year was 161,976. You consensed at 56,980. Just to let you know, if we were to follow the sunset path for 26-27, it was proposed at 25% of their request of the original 131,500, which would have been 32,875.
and trustee Kent, I remember you having a discussion about this, keeping those that we started.
I mean, we gave them the money to set these people up with these
Mhm.
devices and that number was 233. Whether it still is 233, I don't know. My approach was trying to look at service costs only to maintain that. And that led me to the 56,980.
Right.
That's where that number came from.
And Ms. Horzell did confirm that there was 233 active clients, and then there
Okay.
was 234 individuals on a wait list.
Okay. So there's consensus around 56,980, yet we had agreed last year that the funding would be 25%.
32.
With 32,875, so can we have a discussion around those two numbers? No, we can't.
Well, I'm a little confused. I thought the consensus was around the 50% sunset level of 56,980, not the 25.
Yeah, I don't,
Oh,
Yeah.
I heard.
Well, so, okay, so 25-26 was approved at 50% of their original request, which was 131,500, which gave them the 65,750. So for this next year, 26-27, it was proposed at 25% of their request of the same amount, original, 131,500, and that's 32,875.
So. This is Michael, so the difference really is. Stay on the sunset path at 25%. My number again was based on maintaining this service only. For those people, as long as they're using the service. Which inherently says we're not gonna sunset it, but
Right.
again, that's a secondary issue.
Right.
I have a question. I have a question for Michael Kent. What percentage, does their numbers show us what percentage we're supporting for this particular program? How much?
Not in my notes, so
Probably not. Over the last 3 programs.
I'm sorry, was the question how much the
What percent?
district is for the budget, for ears, it is 89%.
Okay,
And again, this is one of those programs that push comes to shove. It kind of is on that
it is. Yeah, and we had,
outer low. Yeah. I'm not gonna argue with. You go with the 25% that you said you were gonna give them.
Yeah, and. This may sound surly, not trying to be, but. You know what? Last year we told them something
and we told others.
and others,
Something.
and
Yeah.
so,
32,875.
yeah.
32,875 is what we're at.
Yeah. Trustee Jones,
I agree. That's what I was gonna say. Paul said it better.
trustee Mack, he was right, he said it. Trustee Mackett,
I concur with that.
trustee Kent, as do I, 32,875.
Thank you.
Okay.
Okay, sorry about that.
It's a
Good
little
job.
confusing.
Yeah.
Oh, I have to leave again.
Oh, yes, you have to. Are we doing sunshine or treasure coast?
Doing sunshine.
Yeah.
Yeah, I was gonna say, wait a minute, where?
I'm back.
And then I didn't want to ask why you, that's personal.
Yeah, it's like personal.
Yeah.
I can't keep track of where we are.
Me neither.
Okay, sunshine physical therapy.
Okay, so Sunshine Physical Therapy's amended 25-26 budget was approved at 761. Its 26-27 request increased to 1 million, representing an increase of 31.4%. The projected annualized expenditure is about is approximately $775, accounting for the reported suspension of services in June due to a water main leak. Following discussion, the trustees reached consensus to approve a budget of $840,000 with an asterisk indicating the amount will be discussed further. During public comment, Ms. Blossom, and she is here today, if you have any questions, reported that the suspension of services in June due to the water main leak resulted in a slight decrease in service volume. However, she anticipates that service volume will increase again. They have been working on their no-show rates and they've been reducing their cancellation rates and increasing its refill and productivity rates and improving organizational efficiency, which supports her feeling that they will surpass the $840,000 budget that you all consensus on.
Discussion.
Jenny, what's their total operating revenue? Isn't it about 2 million?
Oh, I don't have that. I don't have that.
Agency budget, $3,600,000.
Thanks, Nicole.
The 840, which I think I threw out. Sorry, Jeannie. Was 50% of the increase of the request, as it was a significant increase. And then we were looking at current usage through 7 months was 831. But we're 10 months in, we might have a better number, just what their burn rate is actually this year and what it annualizes to. I don't know that. I know that it wasn't. Probably.
You have July, I have to June.
So total expenses through July is $648,050, which is 85.16% of $761. That's after the 81,000 additional approved this year.
85%,
Correct.
so they're on track.
Correct.
Back on track.
Mm-hmm.
Clinic reopened.
Yeah.
Jenny, 80% of these are kids,
85.
85%.
I support continuing at 840.
Trustee Jones?
Yeah, I support continuing at 840. I mean, I'm aware that 4 years ago, this was 150. So this is one of the big increases. And the principal reason for this is Medicaid, which I think is what we're supplementing. And I think it's worthy. I think we should do it. But at some point, with the constraints that we're confronted with, organizations are going to have to find some way to support themselves. So 840 out of 36, that gives us, a fairly high percentage of their total budget. So I'm good with 840.
Trustee Westcott?
I'm the same.
Trustee Kent?
Okay,
I am as well, $840,000.
You forgot me.
Oh, I'm sorry.
It's okay, it's okay. I was gone for a while and I came back.
Trustee Eagle.
I'm good.
Thank you very much. I apologize.
Now,
Okay, now.
CCH?
Yes. Okay, we're doing.
Yeah.
Yeah, I do have two. I have the dental services, which, so TCCH was recently approved for additional funding for both of these programs as they were exceeding their budget with current encounters. For the dental services, their annualized expenditures are projected at 1,000,008, which is approximately 9.5% higher than its 26-27 funding request of 1.6. Similarly, the annualized expenditures for behavioral health, let's just stop with the
Yeah.
dental first, sorry.
Okay, so we asterisk this because of the annualized expenditure is projected at 1.8, 0.5% higher than their request of 1.6. So what,
I don't know why,
It's the large increase.
it was just a large
Alex
increase,
was
but
having
they,
some percentage.
but they also were just approved for 483,000 additional. Funding for that because they were extremely over their
right,
budget.
76% increase or something like that. I think that's what Warren said. I think Warren's on here. Yes.
trustee Jones?
Yeah, he is.
I don't know what number has been proposed. I mean,
Well-
the request was 1,674,000,
That's what
Right.
but
we,
they're running at 1,800,000.
They're still running over that, yeah.
If then you gave them,
that was our, we, not approved, but
Right.
recommended
Recommend.
full funding. And they're running hot still?
Mhm.
Yeah.
Right, but they're running over their request for next year. Currently.
Trustee,
I'm okay with our prior decision.
1674323.
Correct.
Trustee Beagle,
Me too.
thank you. Okay, behavioral health.
Same with behavioral health, they recently came back and asked for an additional 182,045, bringing their amended budget to 701,467. Their request for 26/7 is 656,818, which again, these requests were made in February and.
So. 656,818 is consensus, so.
That was the consensus.
You gonna stay with that? Trustee Beagle,
I am. Mhm.
trustee Jones?
Yes,
Yes, okay. 656,818, okay. Last one will be whole family when trustee Mackett comes back.
And it was just for the lab services of.
Came back, Kate left.
Okay,
Okay,
lab services.
the last one is full families lab services, 26/27 budget request for lab services, let's see. Well, originally was, it was 85,000. And their annual projections as of October, 10 months in, as of July 31st, that was. 70.6% over the approved budget. Let's see, so they are running, and then the request is 184,992. Let me just see, so yeah, then there was a question by trustee Westcott about. An analysis compared from the bundled versus unbundled, and we did ask for an analysis from the whole family, and we received it, and I'm gonna let Frank.
Yeah, so
speak
we
to it.
talked through this, this is Frank. So we talked through this with Dan and Marie. And we worked together on an analysis, we reviewed the analysis on Monday in preparation for today, and here's what the analysis found. So I want you to think about billing in three different ways for a second, okay? I want you to think about doing it per patient, per draw, and then per test, and so. What we found was that the switch to per test was actually less. We were, the fee for service rate we set was $25 per test, and actually the totals came out to be less. It was the least, God bless you, not by much, but the least most inexpensive way to do the billing. However, after we had the discussion, what made the most sense is for us to do this by draw. Because you could have one patient who may have two draws, but coming up with a fee for service per draw was the most logical way to do this. What's the rate we came up with, Jenny?
It was, 150.
Right, so that projection is consistent, it's consistent with the others, it's gonna be the best way for us to track it, record it.
Did great.
Exactly.
And it's consistent with what, based on Dr. Mackett's comments,
Yeah.
industry standard as well.
Yeah, it is.
I'm sorry, can you explain draw? Because my experience is when I go in, they make a draw with one puncture and they take different vials.
Correct, and that's it exactly, Alan, is that correct? But that one patient may come back 2 times in a month for 2 different draws. So to do it by
A
draw,
draw is the insertion of the needle to draw blood. It's
Correct,
not each
correct.
individual vial.
that's correct, the phlebotomist does the draw and they take anywhere from 1 to 6, 7, 8 tubes.
I just
Correct.
wanted to be sure I understood what you were saying. Okay, thank you.
Yeah.
And so the consensus was not necessarily on the 184,992, that it was basically on how we were being charged for the test, yes.
And does it come out to be the same?
Yeah, it was
Yeah.
really like.
Yeah, within a few
Yeah,
$1,000,
it was a couple $1,000,
but it was less.
But ours was less,
Yeah,
yeah.
ours was
What we
less.
paid was
Per
less.
test was like.
But why is it up over 100%?
Volume based. We walked through all the numbers with them on Monday, volume based, and in fact,
It's not an increase in patients, just an increase in draws.
well, no, it's an increase in both,
Right,
yeah.
because the way we were paying, the encounter we were paying before was, yeah.
Dr. Mackett?
Yeah, Dr. Mackett speaking. Earlier this week or late last week, you sent us a very
Right.
encouraging email. And congratulations.
Congratulations.
Team, that they are now going to become a full FQHC.
Yeah.
We're on
And-
that.
Yeah, and my question is, how do we anticipate that's gonna impact their need for funding for things like this?
While I can't answer that question, let me speak to, because they don't know yet. So they know that they were awarded this one funding for this next year, but what's gonna happen after that, they don't know. So this is still in process. One of the questions that a couple of trustees have asked is, because this is by county, will this affect TCCH? Absolutely not. Because HRSA sets up FQHCs by service area, not, as you know, not by county. So it's very possible that they could essentially bring in a lot of money, and they're eligible for the 330 federal funding like TCCH gets. They're eligible for the FTCA and malpractice, significant reduction in med malpractice bill. So this could be very impactful for them. But as far as what the future looks like beyond this year, I spoke with Marie yesterday on this. They simply don't know yet.
Okay. Thank you.
Question on that one. Karen Deagle speaking. You had mentioned, and it was me who asked that question, whether or not funding affects TCCH, because usually with feds, they have a pot of money,
Right.
Yeah.
you know. So if
Right.
it's service area and not county, they're both in the same service area. So how does that, is that, I don't know. It's not, it
Not
is?
necessarily.
Yeah, I can't explain the technicality besides that, and perhaps, Marie or Dan can, but
At
I just
another
know
time,
that it
okay.
doesn't, it doesn't affect TCCH.
Okay.
So we're at 184,992, correct? So we're, and
And the testing and using the draw rate just still works out.
Close
Yes.
enough.
It does.
Okay,
Yes.
then I'm good.
Same here. Thank you.
trustee Jones?
Well, I had a lower number just because I have trouble with doubling the amount. We can't keep doing that based on. So my number is a little arbitrary. I originally increased it 10%, but I would go with something like 120.
Everybody.
I'm good with the original.
184,992. Bill, trustee Mackett?
Yeah, just a question in light of trustee Jones's comments. Remind me, what's the percentage increase in patients?
In encounters, let's see.
No, he didn't ask encounters. He asked patients.
No, I only have encounters, that's how it's presented to us, and you're talking about just for the lab. For, estimated total encounters for this year I have is 5,483. And they requested. There's so many sheets here. Projected encounter 7,872 for next year.
And that's like,
Based on, yeah, that was based on tests, so we'll have to do an
We've
adjustment.
gotta do it with dust if we draw,
Yeah.
we'll adjust,
but in any event, it's likely to increase more than one.
that's what's expected.
Yeah, so, I am happy with the current number, although I fully expect we'll have a deeper dive next year when they
Mhm.
understand what their funding is.
Mhm.
Mr. Westcott?
I can agree with the previous number, yeah.
Okay, 184,992. Okay. Do something want to know where we're at with that? Right?
Yes,
So trustees, with those reductions, that brings, those reductions, the value of those reductions were 152,826. So where we currently stand at this moment, remember the tentative millage we set was 7,450. So that would increase our reserves to 6.47 million, with the sale of the HSB brings it to 11.12 million. So as we sit here today with the above numbers, everything that we've discussed in the past month, our reserves sit with the sale executed at 11.12 at 7,450. And I know the next question is gonna be, where is it at the rollback? So we'll do that. So at the rollback, our reserves are 5.3 million, add the HSB that B sale, that brings us to 10.0. So $10 million is where we are at 7,121 after all those changes.
with some vagaries with people requesting some additional.
Mhm.
And we cut $1,800,000 from the requests. With these recommended. with these
Reduce the
consensus.
increases by 1.8.
Yeah, yeah.
Okay, trustee Westcott?
Yeah, it's not, we didn't have an asterisk next to it, but the whole family health bridge care program. I looked at that one again, and the cost per encounter is $192. What I'm trying to discern exactly is how is that being calculated? In other words, are we reimbursing usual and customary, against our rate, the differential, because these are the underinsured, so they meet the threshold for, less than 200% of the poverty rate, for the income level. But they may have insurance, and the insurance is maybe a catastrophic plan or whatever, so I get billed for a service for $100, my carrier pays $20 of that. I meet the 200% threshold. How is that bill gonna get processed? How are we arriving at the $192 per encounter?
Well, first of all, so there's already a process in place, as you know, through Sunshine, where we where we offset their reimbursement and increase that reimbursement to something that's more reasonable. We have not, while this is something that the trustees have discussed, this came through the LOI, we've discussed it here, we've developed consensus around the 184,992. The fee for service rate was built into the application. The way we handle things like this is we have to sit with Marie and Dan and work through the fee for service rate. What's on the application is often not what ends up. We have to measure that against, okay, so how do you define an encounter? And then how is this consistent with our fee for service rate sheet, and how it's consistent for with CMS, the physician fee schedule, and how this is in alignment with what we pay the others for the same type of service. We have not done that yet.
Mr. Mackett?
Dr. Mackett speaking. So are you referencing the new program that I believe?
Yes,
trustee
correct.
Westcott, okay. Because you quoted the same number.
Oh, I read
For the
laboratory, I'm sorry, I
for
meant
the lab
200,000, I apologize.
Okay,
I-
all right.
Yeah.
I just wanted to make sure.
Yeah,
we
you're
were
right.
talking apples to apples.
Yeah.
And while there's a need, there are several other entities that probably would want to come to the table and be treated similarly. And I whether or not this is a good year for us to start a program, I guess is the question I'm asking. And I know, Alan, at our last meeting said 100. I've had concerns about this one for a multitude of reasons. You kind of helped a little bit in terms of how the mechanics are gonna work. But I just thought this was, while we didn't put an asterisk next to it, might want to talk about it a little bit more.
Well, it's two new program, and Church Coast Community Health has a new one as well.
Right.
Do I remember? So would we do a similar conversation around?
Theirs is the,
Their women's health.
That's the
fund,
women.
I don't know if it's a distinction that would make a difference for us. We may want to, but one is a more traditional method of operation for us, while this one is completely new.
Dr. Mackett.
Yeah, Dr. Mackett speaking. I believe I was the trustee who recommended 100,000 as a pilot project because it is new. I could look at revisiting it.
Yeah, it's Michael Kent, again, big picture. We talked a little bit about this when we went through it the first time. We have often talked about this particular group of individuals. And we've never had the opportunity to kind of figure it out. In the big picture, as much as we'd like to be able to step in and fill this void, I'm not sure where I land, but this might be one of those things where we need to step away from. Just because at this point in time, it's hard, again, that being zealous about wanting to serve absolutely everybody may not be the case. If $100,000 would be I like the idea of a pilot, it's also gonna force us, meaning staff, to really get into the nuts and bolts about exactly how this might work, so that we can then make a judgment when all those other folks step up and say, well, if you're doing it for them. But we'd have a test case, a pilot program that could maybe answer some of the questions for us that, in the grand scheme of things, we're having to make some really subjective judgments versus there's a clean way to do this.
I agree with Michael. However, I would probably question whether or not. Two things, whether or not the 100,000 is enough to have a pilot program. And if it is not enough, maybe set it aside, again, going back to the assumptions, the risk, that kind of thing. Let's get over the November election, and say, work on this with whole family. I agree, we have talked about it for many years. I would just hate to open up Pandora's box and not be able to continue the program because it opened Pandora's box. But I don't know, again, is $100,000 enough to do a project and get good results out of it? And if it is, then fine.
To amplify, so this is something that ostensibly we put on a back burner, see what happens in November, and if we can reapproach the topic, then. And
Absolutely.
at that point, our knowledge of what the future holds will be a little more solid for us.
I don't have a say.
Oh, no, I was just asking, I'm sorry, Dr. Mackett
yeah.
speaking. Can we put off a budget decision for next year till November?
No, you need to have the
Yeah.
money in there and a line item. I mean, yeah. I
The
know,
only
John, you can amend a budget, but for budget summary purposes, reporting, we really need to have that line item.
Total
In the final budget, you can obviously move
Or
money.
pay for it out of reserves.
Yeah.
Right.
There'd be another way to
It
do
wouldn't
it.
be good for accounting though, because we have, in QuickBooks, we've got budget line items for, so your P and L is not gonna have it on there, so you're not gonna be able to look at it each month about what you're spending.
The other way to do it would be this, you take so it doesn't eat into reserves. You take the difference, you take the value in terms of millage between 7121 plus $200,000 or whatever that is. Set that as the millage. I'm just saying, and then that money is there essentially built into your budget. It's in reserves, but it's essentially you're not taking from reserves.
Are we taking from the program?
We're taking
If
from
it's not
reserve.
budgeted, yeah.
No, but the point was you deliberately raised the millage just enough to cover that future cost that you may or may not.
I would too. Right,
Woman's health fund.
right. Thank you.
Yes.
Okay, so where are we here? I hear two
I'm like-
things. Oh, trustee Jones, thank you.
Yeah, I think Paul raises a very good point, as does Michael and Chuck. I believe that this is one of those hard decisions. We got to start dealing with stuff. The facts have changed for us. That's the way I look at it. And so this is a new program. I think the concept, maybe this is not the year to explore a new program, is where I would fall. So I actually would be in favor of not approving that element of the budget until we know more about where we stand. Because we take 300,000 out for bridge care, maybe it opens up Pandora's box. In the meantime, we're going to be constrained with our assets in the future. So I think it's good to bring this one up and make a decision where I would stand now. I started off really supporting this program, but the world has changed. And I think this would be one of the things I would not want to expand our definition of who we support at this time. So I'd be in favor of zero.
If we go in that direction, and I might be open to that. Do we go back and look at TCCH's Women's Health Fund? And
It's a pilot.
just based, I mean, that's $500,000 between those two programs. And we need to maybe say no now.
But maybe next year.
Are they already trudging forward and ready to implement
I
this?
feel like that question was asked and she said, they just wouldn't be able to serve the patients if the funds weren't there.
Well, I mean, we like both these programs for different reasons and at different levels. But in the face of what we've come up against now,
I think it would be prudent of us
I
not
think
to.
that's $500,000 that isn't cutting the existing program.
Right.
It's putting a pause maybe on something that we would like to look at in the future.
What was TCCH's number?
300,000.
Do I have consensus on that?
Well, I can
Oh, no,
only
sorry.
speak to
Right,
whole family, but
Right.
I have to leave the.
Okay.
board.
okay, so what will you say for whole family? The pilot,
I can concur.
okay. Trustee.
I agree with Alan.
And Alan,
I concur, not,
Okay.
not to fund
okay, so nothing.
This is whole family?
This is
Right.
whole
the
family.
whole family.
All right.
Yeah. Okay, thank you. Now let's go to Treasure Coast Community Health when. Trustee Mathis.
Madam Chair, can I just clarify something as well?
Mhm.
There's the We Care program that's also new. Are we talking about all new programs for next
Well, that's
year?
right, they did. Well, let's see what,
Yeah,
One at a time.
okay, Treasure Coast Community Health. The request is $300,000 for the bridge. Is that?
Women's Health Fund.
Women's Health Fund, excuse me, yeah, thank you.
What was that for again, please? Sorry, Karen Davis speaking.
this is the special fund to pap smears, mammograms, ultrasounds, biopsies for those uninsured, underinsured.
That was a good program. And
Working with rural
they
radio.
did, and they partnered with
Cleveland. Yeah.
Cleveland.
I mean, they're good. I get it. Alan started this whole thing about having to make those hard decisions. I think
Yeah,
I like, well, that I like it. The fact that these are not current programs. We're not shutting them down. We're not making it difficult.
Right.
We're saying not yet, but we certainly want to look at perhaps in the future. That's a smart move. So I'm in favor of
I am as well.
backing away from that program.
Let's do a stop.
Kind of regret that I brought up the bridge care program, because I like this one, but I think for the sake of what we need to be doing right now, I think that's the right move as well.
I concur,
Trustee Jones.
unfortunately.
I'm afraid I agree.
Okay. So, well, not yet.
Yeah, he has to
We care.
recruits for We Care as well.
Oh, okay.
Okay.
So we're doing it all in favor kind of thing, or we just
No,
concurring? That's right.
it's-
Thank you, thank you. Get lost.
Okay, repair.
27,000.
And what is it?
GI clinics.
Yeah.
Do the same though.
Bob was page one,
115.
27,000, okay. And this is a brand new program,
That's correct.
okay.
Got it.
Okay, good show.
The gastro.
No, we got faster.
Okay, so, $27,000.
To be consistent, I
Yeah.
say that we have to do the same, no new programs this year.
I agree. Trustee Jones,
Okay, it's such a small amount of money, doesn't affect the budget much.
well,
And We Care has not grown their organization like these others have
Yeah.
over the years. But I agree with Karen's comment to be consistent, I guess. I don't feel strongly about it. I would leave that in. I don't think it matters. And it might help somebody.
Have they embarked on this program, do we know
We're
already?
doing it currently.
They're doing
This
it.
would expand upon the service.
That's subtly different.
you wanna,
It was new to us.
new to us.
Cost is extremely low because the group, the GI group donates.
Yeah,
The
that's what I'm
time,
saying.
the speed hits really make it really easy.
For me, it's a difficult call because it's a nominal amount that leverages so much. And
It's new,
and you know,
So it's not a brand new program,
Correct.
like the other two were brand new programs that haven't started yet because they're not getting the funding.
Right.
This program is actually operating, they're actually doing it now, and they've partnered with, and so that, that difference I can
Yeah,
understand
no.
because it's
we were on the pilot program, was what we're looking at, was
Right.
those two,
the other two.
they were.
But let me also be clear that TCCH's program, that relationship between women going for mammograms and all that with uroradiology, Cleveland Clinic, that's been happening for a
That's
long
been
time.
happening.
Oh,
for a while.
see.
It's just that we
Oh,
haven't
well
been,
then. Okay, guys.
it's been restructured in a way that they've asked us to pay for it, but.
That's what I recall too. Thank you.
New to us.
Hmm?
New
New to us.
Gotcha, it would reduce the amount of patients that were being able to be served if the district did not support the program.
Hard decisions, guys. I mean, this is what it's all about. This is where
So-
the rubber meets the road. And
Like I said, I'm not a black and white guy, so I'll break my own rule. This is such a nominal amount of money. I still support $27,000.
What is this going toward the cost of the services being provided? So it's a,
Colonoscopies for,
Yeah.
for people who have no
Materials
insurance and
Yeah,
materials, yeah.
materials and
Yeah,
things.
very-
The
And
doctors
the doctor is providing.
provide
this
this
for free.
I have to, I am more of a black and white person when it comes to this kind of stuff because 27, it doesn't sound like a lot, but I'll tell you what, 27,000 to some of these other people could mean a whole lot too. So I'm,
I'm with you, Karen.
I can't,
Yeah.
if we're cutting those other two,
If-
fairness, there's there, I'm sorry.
It's not the dollar amount.
No, it is not the dollar amount.
I've joined you.
Oh,
Sorry.
All right, so we're at 3
To two.
to 2, so we have consensus. Okay. All right. Moving back.
Are we revisiting women's fund or no?
We just did.
No, that was for We Care, I thought.
Yeah, that was for weekend.
Right, no, we're sticking with the other,
Yeah,
what we
I-
decided, all three are new programs to us, and we said no new programs.
Okay. Okay, back to the impact. So trustee can't use. You made a comment before that discussion was we had reduced. The total, we had decreased 1.8 million.
Yeah, and I'm realizing my formula is wrong.
Oh,
I was just there. Requested funding was just over $23 million. Our new consensus total is just over 21, so we've cut about $2 million from the initial requests.
and we're going into reserves 2.3.
No, we're going to reserves now, 1.646.
Okay, 1.
So just to give you an idea, this is a 1.75% decrease from last year's approved budget. At the rollback rate, it would put us at 1.646 deficit against our reserves. Which would, after the capital TCCH, this leaves us with reserves at 7121 of 10.53 million.
Which is above the
Mhm.
parameters. Michael, the goalposts.
Right now.
So where do we go from here?
A group develop consensus, or just vote on the.
Yeah. Are we ready to do that? Okay. Do we have, okay, so consensus on the mills was 0.7.
0.7450.
Okay, so that's what we're voting on,
As a
correct?
place marker.
Back then it was a place mark, right?
I make a motion that our millage rate be 0.7450.
Do I have a second?
Second,
Thank you. Discussion.
Frank, would you go over again where we end up at 0.7
Sure,
with this?
sure. So at 0.7450. The difference between our revenue and expenses is $530,000, which is the lowest we've probably had in years. So that would be, meaning we're going to be spending only 530,000 more than we're taking in revenue. This is at 7450. That would leave us with reserves after the sale of the HSB payment to TCCH for capital of 11.65 million in reserves, 11.65. We'll compare that same, those same points to 7121. At 0.7121, we are spending 1.65 million more than we're taking in. Including, so we go to reserves, payment to TCCH for capital, we end up at 10.53 in reserves, 10.53 on September 30th of next year.
Would that amount be reduced by anything we happen to approve tomorrow night for a supplemental budget?
yes,
Yeah,
Okay,
and those two requests are combined to 200 and,
What's the number, Jenny?
190 and 75.
yeah,
So
265, that's what I was thinking.
So the 265 request that tomorrow night that the trustees will hear, but that's supposed to be expended between now and September 30th of this year.
Which would lower reserves by that amount.
Correct.
It if you fully fund it.
Right.
Other discussion?
Well,
Public comments.
I think that I've fallen in, what I'm trying to do is to get us down to the rollback rate. I would love to do that. And I would love to prove that, and these discussions are illustrating it, that it's going to be very hard to do that without hurting the community somewhat. So, but I guess where I sit at the moment, without having done the actual calculations, somewhere between the rollback rate and 0.745. I think we can take more than $500,000 out of reserves, but I don't want to take 2.6 out or 2.3 out. So
It's-
that's kind of where my thinking is evolving. And I'm not really ready to make a decision at this moment. I need to think about it some more.
You have to do
Yeah.
it. You
Yeah.
have to do it. Sorry.
Trustee Westcott.
I have a so it's 1.65 million that we're gonna be taking out at the 7,121 rate.
That's correct.
Okay. Alan, I thought I heard you say 2 million. I just wanna,
I'm sorry, you're right. We made some progress today, actually.
yeah,
And take that into
Yeah.
account. You're right.
and our reserves. If we fully fund the request tomorrow, our reserves will be 10.275 million.
Let me just be clear, it's reserves and cash.
Right.
So it's
Yeah.
everything we have.
Right.
I'm in that place I was at the end of the last meeting and where I started today's meeting. It helps me to see what the next two subsequent years are by making this decision of whatever the number, whatever the millage number is. And I don't know if that's an easy thing for you to plug in.
Absolutely, sir. Just if you could talk about something else.
I could, Matt's here.
Trustee-
So today's not the last day. This isn't it. We've got till September 3rd. And that's when we have to vote on.
Yeah.
The final.
Final.
So, and that's why I say, leave it where.
You actually vote on the final on the 8th, so
8th,
September
right.
3rd is the first hearing.
Right,
So what you would decide today needs to be the same as September 3rd.
3rd, and then
And
you
then
can change,
between September 3rd and the 8th, you can change it.
you
But
can drop it.
in order for us to be compliant with trim reporting requirements, I need these numbers today so I can get them. And so what's decided today will need to be voted on the 3rd.
Right, okay, so. Obviously. The reason I'm saying the 0.7450 is it's the highest we can go. We've still got some work to do here,
Down.
and you've still got time to bring it down to whether it's 0.71 whatever, or 0.75, or whatever it ends up being after we do a little bit more work.
Yeah.
Let's give us some more time. The 0.7450 is not the final here, and that's why I have put that motion on the table.
You could have a meeting on September 8th that day before the final hearing and reduce it more for an approval that night.
Trustee Cat.
I think you misspoke in one area about what we could do. I believe we've set the cap. Right.
Yeah.
The cap cannot be
No,
above
that's why I
0.74.
wanna stay at the cap, is what I'm saying. I'd like
She
to.
said 7.5. Yeah.
Oh.
You rounded up. You rounded up.
I'm sorry, no, didn't mean it.
Yes, trustee Westcott.
for clarification though, if we were to decide the 0.727121 today, we can still go up. In other words.
No,
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 no.
It gets published.
it gets published and you can
Published.
only go down after that, you cannot go up.
Well, I didn't know that.
Yeah,
Has to go.
that's the
to trim
importance of
report.
this.
I just learned something.
Yes.
Yeah.
This is going into the community, so all of the summary and then it's,
Mhm.
even though is over the rollback rate, it's gonna be a notice of proposed tax increase. There's a small percentage, I think Frank has that. But you can lower it
Yeah.
on the 8th. And that will be our final approved budget for the year. It will go on the website and it'll go to the
With
state,
funds,
Right,
Okay,
so we have time to
reduce it.
reduce it still.
okay.
And this Michael and It's just the way my brain is working. I wanna see 3 years out where we're going to be.
That's right.
I wanna see what the rollbacks would be, et cetera. I'm thinking
Yeah.
that there's a number somewhere between,
Correct, yeah.
you know, 0.7121, 0.7450 that might make us all feel like we can be solid enough for
Right.
4 or 5 years out. And get a feel for it.
With I started doing the calculations and just realized, take all the calculations that we talked about this morning, add 680,000 to them. That's basically we're saving 680,000 on the spreadsheets that I've just distributed. So, and I can update them all and send them out under all the different scenarios.
Assuming all those assumptions you made
Right.
bear fruit.
Correct.
I think Karen makes a lot of sense. I think I'll support staying where we are for the moment.
Right. Any other discussion? Public comment? Yes, sir.
Sit here.
Yeah, well, we can come over here.
For the record, my name is Bob Atwater, resident of the town of New River Shores. At the start of this agenda item, no one on this board recused themselves. Yet I watched multiple members walk out when there was discussion regarding organizations which they're affiliated. Now, I have been a public official for about 10 years, attended ethics courses. And never once in those ethic courses did I hear that you could not participate in the discussion, yet vote on the item itself. You folks are coming up with a budget and a proposed rate that has the components of all the discussions of the line items you did. I don't believe that any of those members who walked out during this discussion have the right to vote for the entire package. You can't delineate it out. I've talked with other attorneys about this. And never once did it come up in a ethics discussion where you could bifurcate that. So I think those votes are invalid. Now, if your hospital attorney does something different, I'd sure like to see it, and I'm making a public records request for it. But I've never heard of any organization where you just walk out, not have the discussion, and then come back and vote for the entire package, which includes you. Thank you.
Any other public comment? Hearing none? All in favor?
Aye.
Aye.
All, any opposed?
Nay.
Nay.
Two. So we're
Gonna
at,
pass.
right. Okay, so,
I move that the millage rate for the trim reports be set at 7.7121, the rollover. Right.
there's a second,
Second.
thank you. Discussion,
Wait, yes. So the last one did not pass
correct.
because it was a tie? Or
No,
what?
because
We
it's
just,
in a majority.
there wasn't a majority. Okay, I didn't catch all of those. So now we have a motion on the table for,
7121.
The rollback. Any discussion?
Wait a minute, I think that's not accurate. I think the last one didn't pass, not because it didn't have a majority,
There's a super
because
majority.
we had 2 nays.
Correct.
Correct.
okay, and it has to be super majority?
5 yeses.
We need
5
5
yeses.
It's 2/3.
For what? Because it is above the rollback rate.
Yes.
Got it. Okay, and the rollback rate is this 0.71.
2-1.
Default is always the rollback rate unless
Got it.
we have 5 or 6.
Okay.
And this is Michael, in terms of discussion, I'm not comfortable doing that yet. You're gonna lock us. If we get 5 votes for that, we're locked. And can't raise it even 1/1000th of a point. Could we split the difference? Is there a number somewhere between the two that as a spot placeholder? We could move forward on? I'm not suggesting you halfway, I think that I'd like to have a little room, once I see the rework sheets and see what the millages are gonna be in subsequent years. It helps. I guess I can just add $685,000 to all of them.
Trustee Beagle?
That's where I'd rather go.
And I have to say, I agree with Michael, and if it goes back to the 0.71 to the rollback rate, we're gonna have to go back here and do some more cutting on everyone, not just one or two, but on everyone, I think. We're just gonna have to do a certain percentage in all fairness, just, yeah.
Trustee Mackett?
Dr. Mackett speaking. I think I heard, and correct me if I'm wrong, because I could be. That where we stand now, if we set the maximum rate at 7,121. Even with approval of full funding for the additional requests tomorrow night. We will still be above our target reserve rate.
That's correct.
Right.
For 2 years.
For 2 years.
Right, and I am not prepared to support a higher number. Assuming that Amendment 3 is going to pass. Assuming that spending stays flat and that we don't change the reserve policy. And assuming that the GTV does not increase. I just can't do that at this point. I'm very happy to discuss that next year. If any of those things become true.
Further discussion? I'm not prepared to be at the 7.7121. I would be more comfortable once we get through November. That's too big of a assumption for me. That's not gonna pass.
I split the difference just to say it,
Yeah.
the literal difference between the two is 0.7285 or 0.72.
Sound like a mediator, split the difference.
0.7285 puts us at. Instead of the 721, the 1.646 coming out of reserves, we'd only take $1,089,000 out of reserves. That leaves us with reserves of $11,087,000. If we approve tomorrow night, that still puts us at 10,9, 10,7,5, something like that.
Karen,
Yes.
Karen Deagle speaking, and again, I'm not looking at like today. I'm looking at a year from now, 2 years from now. I think that was a really good analysis you did of where, this isn't all about what's happening this year. This is all about what's happening going down. And those assumptions are just too risky. Too many of them.
All those variables that we keep talking about.
I know.
And Dr. Mackett might be right. I don't.
I don't know.
No.
That's exactly it. We don't know, and that's it. So I like to take the safe road.
I'd like them to, right? Trustee Jones, or you said somewhere in the middle, or some.
Well, yeah, I started off there. I think I kind of like Michael's proposal. I don't think from my point of view, my goal is to get to the rollback rate, but not at the expense of hurting the community and the service. And I think we're still in that analysis. We made some progress today, but I think we have more work to do. And so the idea of putting ourselves where we don't have flexibility to help the community doesn't make sense to me. So I do not want to go to the rollback rate at this time. I will vote no right now.
I vote no.
Let's go to public comment. Any public comment? Yes, sir.
Just, Dan Bach from Whole Family Health Center. Just for clarification, on the supermajority vote, it's a 10% increase over the rollback rate, is that correct?
Yeah, but we're already past.
You can go up to 10%,
Okay.
correct, with a supermajority.
Okay, so just for my clarification, so we're looking at 0.745 and 0.71, excuse me, 0.7121. 0.745 is a 4.6% increase.
Correct. Correct,
Over 0.7121.
right. It doesn't matter. The default is the rollback. If we can't get agreement among the trustees, it automatically goes to 7121.
I thought the supermajority related to 10.
10%,
No, that's-
that's what I thought too.
No, it's a unanimous,
It's
it's
if
a
you
unanimous vote.
That's what I
More
wanted
than
to-
10%.
up to
Above.
10% over the rollback rate, that's the supermajority. Then above 110% requires unanimous vote.
Which we don't have because we don't have 7 people.
You
We
can't
can never do that anyhow.
Trustee Mack.
No, I was just gonna clarify that.
Okay. All right. So we're on public comment on the motion that's on the table, 0.7121, correct? Okay,
So it was a motion by
No,
Duff and it was second
Second by
by
Paul.
Paul. Okay,
Yeah.
thank you.
all in favor?
Aye.
Okay, we have two, trustee Mackett, trustee Westcott, all opposed?
Aye.
Aye. Trustee Jones?
I'm opposed.
Okay, so 4 opposed, 2 ayes.
I'll move to split the difference, 0.7285.
Do a second
Second that.
discussion? Yes.
Yeah, Dr. Mackett speaking. So if it were 0.7825, we would still be sending out a trim report to the taxpayers saying we're gonna increase their taxes.
By 2.3%.
2.3, and that'll be at the top, so they'll see the small increase, but yes.
Yeah.
Anything over the rollback rate, we have to post that, I mean,
Right.
And announce it when we write our
right,
script. for
from
the
what we're seeing,
public
pretty much
hearing.
everyone is gonna be doing that.
Everybody's doing it.
Yeah.
I think it was 36% with
Yeah.
mosquito district.
Yeah.
I think the county's gone up,
Yeah.
or is maintaining.
Yeah, the county, if you look
But
at your
still-
tax bill, the county has maintained, I discussed this with the property appraiser's office yesterday, everyone's maintained their tentative
Yeah.
millage, so that they have for this year, for their tentative, everyone's maintained the same with the exception of mosquito,
Yeah.
which has gone up, they're like 98% of their maximum millage. But also know that we are the second lowest, only county municipal is lower than us. We are the second lowest taxing authority out of 10 at 14.9%. The county municipal is the only one who's lower, but everyone else is in the 30 or 40% of the maximum millage.
So this trim notice has already gone out, so if you're worried about people saying, oh. You raised.
No,
the
no, I'm
taxes,"
just
it's already
wanted to
out there.
clarify.
No, but it's
Yeah.
spelled out.
Yeah, not worried.
Okay, so the motion on the table is 0.7285.
285.
Okay, I heard a different number a minute ago with what I did.
How about that?
We've done public comment, right? So all in favor?
Aye.
All opposed? Oh,
Alan said that.
okay, so we had 3.
I don't have it yet.
It failed.
Well, no, it hasn't, not everybody's voted.
Oh, I'm sorry.
I haven't heard anything from any
I know.
of that.
Well, I'm in all in favor, and so I didn't know if you're gonna, or all opposed,
Aye.
2.
I'm in favor.
Can I get a voice vote?
We did, I got it.
Yeah, everybody. Still not a win.
So, but what was the final vote?
4-2.
4-2, okay, thank you. Okay.
You guys locked at 7121?
Yeah, yeah.
Yeah, and we've got a margin, I think when the committee meets, we've got a margin, like you said, of 1.5 million on our reserve. ratio, in terms of having more disposable money. I would submit it's possibly even more, so I'm comfortable with where I am.
I need a new motion then for that.
Trustee Teal.
Yeah, I'm quite concerned about the fact that we're using a sale of a property as part of this whole process, this reserve, because when you have a piece of property that's worth what is it? 6.5 million.
Four point six five.
4.65. And you've had that piece of property for well over how many years, since the 70s? And you obtain it, and now you're throwing it into the bucket to be used for operations. I would just think we were a lot smarter about how to invest those dollars, and so that we would have sustainability in the future. I just share that I have a real problem putting those dollars into operational reserves.
Well, we're clearly at an impasse here. Our thinking is not as far apart as it sounds. But Dana, I gotta ask you, that law said 2/3 vote.
Right.
You've interpreted it to mean that requires 5 out of 7. We only have 6.
Correct.
Right.
Governor could appoint our 7th, but he's chosen not to,
Correct.
at least so far. So
And-
why do we need 5 out of 6? I don't understand.
Sure, so the way that the actual law reads is that it is a supermajority based upon the number of seats that you have pursuant to your enacting legislation. So the enacting legislation for the special district, which is the special act, states 7 seats. And that is clear, we got confirmation of that it is supposed to be out of the number of seats that you should have, not the number of seats currently filled. So based upon that, the supermajority here is 5 out of 6, or sorry, yes, 5 out of 6.
2/3.
Correct.
Yes.
Okay, so, given that we are not able to, we're not reaching anywhere, what is next?
Roll.
Yeah, you have to go roll back. Roll back.
Default.
Yep.
Roll back, doesn't fall.
And when do we say that? I mean, is it, or we're to that point where,
Yeah,
Unless there's any other motion.
exactly, yeah.
is there any other motion or consideration?
Do we need to make a formal decision that we're in impasse?
Well, I don't think there necessarily needs to be an impasse. We have the record of the voting, so any of the voting to increase is all represented in the meeting or in the meeting minutes as not passing.
So the
Okay.
documents prepared for the 3rd are just gonna have that rollback rate, even though
Right.
you guys didn't have a formal vote today. All of the other votes
All failed.
default us into that rate, so.
Unless there's any other motions.
Right.
My opinion is we're making this decision while the facts are still moving around a little bit. So I'm not gonna change my vote at this stage. If we have to go to 0.7121, it'll be because 2 of our trustees have forced the rest of us into this position. And I think they're proud of that.
Yeah.
I
think so
hope
too.
we don't
No,
regret this. Because I'm not worried so much about this year or about next year. I think the world is changing, and I think what we do is important to the community. And I just hate that we're not thinking things all the way through while we make a decision. So anyway, we are where we are, so. And I want to say, everybody, I think, is doing this with integrity.
Trustee Mackett.
Yeah, I would only comment that at the rollback number, we still end the year with reserves higher than we projected.
Trustee King.
Because we had a sale.
It's part of our cash and our assets.
Yeah,
This could be the last year that we have that.
that's correct.
Could be. I mean, any number of us can be wrong.
We have a $5 million piece of property out west. So,
Just been sitting there for years.
and Alan, to your point, I appreciate you, the way that you finished. And the reason I say that is I came into this process pretty committed to the rollback rate. And, the mediator in me, I kind of joked with Michael, because I had already done the math. And part of me was thinking that way, but I thought, no, our reserve policy needs to be looked at. And we're still well reserved when we finish at the rate that we're defaulting to. So not an easy decision, but I think one that at the beginning, I came here with, I've had an open mind. And just haven't been convinced to depart from that, but thank you.
Trustee Mackett.
Yeah, I would agree that, my feeling coming in was that we should get as close to the rollback rate as possible. And at our first decision point, I voted for 0.745 to give us flexibility to do more work. And at the end of the day today, I believe we did that work. And at 0.7121, our reserves will still end up higher than projected.
Trustee King.
And the reality is, in a year, they won't be the same faces around the table. There may be new faces. Or there will be faces, maybe we'll have a seventh. The reality is, we'll have a year under our belt. We'll know whether our apartment amendment 3 passed. There will be other things that will come into focus. It still will give us the opportunity at that point in time to step up to the bar if we need to and raise a millage to get to where we feel we need to be to reinstate. From Karen's perspective, some of the money maybe we gave away from the building to do something different with. It's a real world. You gotta deal with what you gotta deal with, is the bottom line here. So, I mean, the decision has been made. Is the bottom line.
Is there any appetite, interest in going back to the rest of the allocations that we're making between now and September the 8th? And do a similar exercise that we did with the ones that we looked at today? And,
I'll respond to that.
oh, thank you.
Yeah, I would like to see the numbers again that was projected with the year 2, 3, that kind of thing, and see if there is a need to do it. So I would say, yes, I think we should. We have from now until September. I think that's our due diligence that we need to be mindful of it. I don't think that our job is done yet.
Just
I
for
agree.
clarification, what you guys decided on today is what needs to be approved on the 3rd.
Right.
And then I think the 8th, because the Monday's a holiday, maybe you guys could have a meeting that day from now until the 8th and work on those line items.
I won't be here. Remember, I'm.
The 8th.
The
you will-
7th.
Right, we're not having it on the 7th, you would have it the 8th before the final
Oh, I
hearing.
thought I heard you say that Monday.
The Monday's a holiday, so the first budget hearing's that Friday. So, the ads are gonna run Sunday, you will have the 8th for your final hearing, but during the day. You could have a meeting to change any of the line items for final approval that day. You probably have a better idea from that, working with Frank.
Is that room over there available to us? I mean, we could just come early, come a couple hours, whatever.
Yeah, I mean, I'd have to find that out.
Yeah, I know, if it's available,
So
show up.
I room right across from.
Yeah,
You can
and
use it.
I mean, we could.
just need a
We
space.
could just be here and then travel over there, whatever you want to do, is easiest. We need to have the owl and so it may be better to have that here. Just because of the TV and all that, it's a public meeting.
Yeah, Dr. Mackett speaking. I'd like to address the question you posed, which is, do we want to go back and revisit? And for me, that answer is no. Because I'm comfortable that we reached a consensus on all of the programs. And that we'll settle on a tax rate and a reserve level that I'm comfortable with. For me personally, I don't need to go back and trim any more money from the budget just to raise our reserves.
Oh, that's not why I asked the question, wasn't about the reserves, it was about being consistent. We looked at, others with a finer tooth comb. I was asking the question, if we want to do the work, as Alan and others have said, do the hard work that we need to do. And do it with all of the requests, not just the ones that had asked. But
I'm comfortable with that.
What can you say, man?
okay.
One of the trustees, and honestly, I don't remember who it was, a few meetings ago, as we were starting this process, you could just take a 2% hatchet across the board. That doesn't work for me in any way, shape or form, and 1% of 2 million is $200,000, I would say, $400,000. I don't like that approach. I'm not against working through. There might be some additional funds that we could, I sense that, I'm probably closer to where Dr. Mackett is, that I think we've really gone pretty thoroughly through most of the others. We've still got a couple of things to come back to talk about relative to future funding, but I think the reality is we pretty much approved the budget today, even if we didn't universally adopt a joint millage rate, we were all comfortable with.
Yeah, I just want to make a comment, and I appreciate each and every one of you. I think that's one of the great things about being on a board over the years that I have, is that we don't all agree. We're very good about agreeing to disagree, and we come out of it and we still respect each other's opinions. And so whether or not I agree with what has happened or what others' opinions are or whatever, I still just want to let everyone know that I completely respect your thoughts and your input.
We all have passion and commitment to the community.
Exactly.
Thank you.
Okay. Okay, one last, we're gonna close that. One last,
No extra meeting?
no.
Okay,
I don't
thank
think
you.
it's for me.
Okay.
One other piece of business, the trustees, as we remember, we have 4-hour ethics training every year that we have to do. I'd like to recommend that we bring it together and we all do it together so we can get it done. Kate has, found, based on experience from seeing this person at the state, special districts meeting, to facilitate that in person, which I think would be
It's really nice.
helpful.
Yeah.
And so I'd like to move forward with that, and so Kate will, attempt to find a date that we're all available.
What's our deadline?
It's December 31st, so I have 2 dates. I don't know if we want to talk about them now, it's getting kind of late, so I can email them to you. It would be early November that this would happen. She's giving me 2 dates, so it would be an 8 to 12 or a 1 to 5. So I'll send that out to you. And if those don't work, you also have the option to do it on your own.
Right. Okay. Any other public comment? Yes.
The approval, this is Cindy Blossom, I'm the executive director of Sunshine. The amount that you all approved today for Sunshine was actually based on erroneous numbers. The amount that we have burn rate would have been 815,000 had we not closed. So what you've approved is in effect a 3% increase for us. We run on about an 18% increase per year. I'm not gonna argue for more funds. I want you to understand the impact that all of this is gonna have on us. We aren't gonna be able to see, it's equivalent of about 2,100 visits we won't be able to provide to kids.
Unless you're able to find additional funding elsewhere.
Correct. It's in effect flat funding. We got the same from CSAC, flat funding. So it is gonna be a gap that we have to fill. I just wanna make sure that you understand the numbers.
Thank you. Thank you. Any other public comment? Anything online?
I haven't seen any.
Great. Thank you all.
You're welcome, thank you.